Aesthetic removable potsherd denture, presented by Sam Afshar. Patient Dr. DG by Dr. Sam Afshar, student number 0959526, MSc Aesthetic Dentistry. Dr. DG is one of the patients of the practice for many years, referred to me by one of my associates, complaining of broken denture, needed desperately something. Looking into his mouth without the broken denture, you can see that the oral hygiene is not good at all. We don't have many maxillary teeth left, and also upper left 3 is broken. He was sent to an endodontist later on to have that tooth root treated because we needed a full post and crown. Lower posterior teeth also missing, but we still have the lower anteriors to rely on. I started with, of course, taking a Facebook, using Facebook, and a preliminary impression to study the case and design the potsherd denture as we wanted to make. These study models were mounted in the articulator immediately in my surgery, so they don't look good now, but the final laboratory one is quite good and satisfactory. It's a few stages making telescopy dentures. You have to have 2 sets of crowns, inner crown, outer crown, or female and male crowns. The first impression, it's like preparing for the bridge work. We have to bear in mind all the bridge works rules and regulations. Once the preparation has been done, we will have the first set of male crowns which will be fitted over the teeth, and the female crowns will actually be lifted with an impression, and they will be fitted into the denture, and these goes into each other, and the crown will be the denture will be retained nicely, no clasp required. Patient wanted to keep upper left 1, so I had to actually trim it slightly and do a little bit of clumsy restoration on it to protect it, but when the denture was fitted, the patient was very happy. As you can see on the video, we have the lab sheet giving specific order to a lab what they do, as this is the first impressions coming, female crowns, male crowns coming back from the laboratory. So I tried them on the actual model, see they fit alright, and later on, of course, on the teeth, including the denture. If everything fits okay, then we send it back to the laboratory to fuse the denture to the crowns. This is actually a finished job, as you can see. I'm checking the angle of insertion to make sure that it sits properly in the mouth. And once this one is tested, I'm quite happy about every aspect of a tooth. I will fit it in the mouth with the male crowns first. Make sure there are no cements left, as they will interfere with the fit of the denture. Here's a denture going in. This is perfectly. As you see, there is no clasps required whatsoever, and the retention is very good.
How does that feel?
Check for the occlusion
Oh yes.
and articulation, anterior guidance or any kind of interference.
Give me a smile, please.
The articulating paper, of course, was used.
Side by side.
At this stage, despite patient not having any lower posterior teeth, he still had a very good retained upper denture. That's showing the quality of the fit and the telescopic denture. Patient was very pleased, but I would be more happy to bring the patient back to make him a lower denture of preferably chrome cobalt. As we see, the contact points are perfectly even all over. Patient was back a few days later as well, 2 weeks later, and still showing the full satisfaction. Now I have a second case to show you, which I did it differently. Mrs. PK, I used milled crowns, attachments, and white clasps. This case, when I took the first impression, I designed it for the laboratory myself, how I wanted. I wanted back teeth, upper sevens, milled crowns. I wanted upper right 3 attachment, and a white clasp around upper left 3. As you can see, this was articulated, so you can study every angle of the patient's occlusion. Patient did not want anything on the bottom, so I took some X-rays, PAs of the posterior teeth. Upper left 3 had a periapical issue, so we sent it to endodontist. The root canal treatment was carried out, and later on post, and the crown with the attachment was made as it was planned from the beginning. And after preparation of the posterior teeth, an impression was taken with impregon. So initially this milled crown was made by the laboratory for us, and the attachment also. And this is several stages. The first stage is to try in the crowns and then take them out with the impression, send them back again to the laboratory so that they can make these milled crown for us. As you can see, we have a bar attachment on the upper right 3. This is the milled crown of the left upper right 7, providing us with a very good retention for the denture with minor discomfort or none. Showing the pictures showing the milled crown from different angles, providing us with sufficient space for the crown coupled material. And this is the attachment, and later on the female part of the attachment will be on the denture, which you will see in a minute. This is upper right 3, as discussed before, a bonded crown with attachment. Shade was A2 as patient wanted to. This is actually attachment for forget here, and the red bit of the attachment was changeable so that we can fit the tightness of the change the tightness of the denture. Yeah, this is a denture made ready for us, so it has to be tried in the mouth, all different parts, the crown and the denture. This is the white clasp on the upper left 3, as it doesn't do anything done on upper left 3. As you can see, shade is A2 as the patient wants to bleach her upper and lower teeth later on, as her choice to do, but didn't want to do it immediately. Once again, this is the attachment of different angles. So all these crowns and attachment was tried in the mouth. I've taken a picture with a mirror. The next slide, so you can see how nicely it's fitting without any problem. It fits perfectly in the mouth. So, but at this stage, when the patient brought it together, I was not happy because the occlusion was not right. So I had to take a bite registration and send it back to the laboratory to something had gone wrong during the procedure, so they had to do this all over again. Once again, they came back a week later. Everything was then okay, and I fitted the crowns with Fuji cement, which Fuji 1, and the denture was perfectly fitted this time. The patient was very pleased, didn't have any issues. You see the bleaching is required as patient wants to do it in a later stage. And now the occlusion articulation is acceptable. Later on, patient needs, as we discussed, to change the colors slightly, but she's happy about that. She's happy to do that in a later stage. There are a few issues with this case that I have to mention. Upper right 2 crown has been made before by someone else, is wider than upper left 2, which I told the patient to do something about it. At the same time, as you can see, upper right 1 has got a filling, needs changing really. It's discolored, it's a composite filling. Upper left 1 has got an actually a minor fracture, or I would say the enamel crack on it is completely asymptomatic. It hasn't got, patient hasn't got any problem with that, but doesn't like the look. She is considering to probably have some porcelain veneers at the front, with changing upper right 2 as well in a later stage. She's also unhappy about the right 1, that she thinks it's quite obvious when she's smiling. I recommended some a composite mock-up so that she can see how it looked like if we change that later on. But overall, she was a very difficult patient to deal with. Thank you very much for your attention.